Welcome to Rewiring Health. This podcast is for those of you who have an eating disorder, chronic pain, or both. In this channel, we'll dive deep into inspirational stories of those who have healed from both, and also get into the mind-body connection and how we can heal the mind through the body, and also heal the body through the mind. Come and join me on this journey. Okay, welcome back to another episode of Rewiring Health. I'm very excited to be joined by Sarah Louie. So Dr. Sarah Louie is a doctor of physical therapy who helps women runners with hip pain to return to running pain-free, faster, and with greater confidence. So welcome, Sarah.
Hi, thanks so much for having me. I'm excited.
Yeah, I'm very excited for this conversation because, of course, so many people enjoy running, and injuries and all that all play a huge role in holding people back from the thing that they truly enjoy. And it's especially with the hip, because I think the hip is sometimes so underrated, and it literally is like the foundation of our bodies. And we have to appreciate how much that plays a role in like back pain all the way up the chain and down the chain. And so I'm really looking forward to this conversation with you.
Yes, me too. Yeah, I love treating the hip. I do think it is like one of the biggest connectors of the body, and it can be linked, as can the rest of the body, but it can be linked to so many different things that could be going on.
Yeah, absolutely. So do you mind just sharing your story of like, how did you get into this work and how has it affected you personally, and just kind of talk about your timeline a little bit about how you got here?
Yeah. So I became a physical therapist, and my first year out of PT school, I went right into an orthopedic residency. And in the area that I was working in, I worked in like a normal outpatient clinic. The area I was working in, there was a lot of, I would say, like kind of younger new moms that were coming in and presenting with hip injuries. And as a new grad, I felt really, really confused on how to treat them. I didn't feel like I knew how to treat labral tears or FAI. And I had these women coming in that were told that they are not a candidate for surgery, but they, and like maybe an injection would help, but there's just a lot of confusion around it. And in those 2 years, so I did an orthopedic residency and fellowship. I had some awesome mentors that taught me so much about how to like really treat these clients well, and taught me tons of great tips and techniques. And then towards the end of my we'll say like excessive schooling, like residency and fellowship, I just got really interested in treating runners with this presentation, because I'm a runner myself. And I wanted to, these are like really, really high level active people, and I wanted to give them like the best treatment possible. So that's where I paired like my passion for treating hips and runners together.
Yeah, I love that. And especially like I was an athlete, and anytime you have an injury, it is like you feel like you've kind of lost yourself. And so
Yes.
when you can address that and help people get better and help them do it confidently and where they feel like they actually will improve, like that's a game changer for so many people. So I love that. I love what you do.
Yeah. It's been awesome. I really enjoy working with athletes in the way that I can work with them, that I can check in with them every day. And if they, if they finish up a run and things didn't go great, they have the access to me to say, hey, what should I do to make this better? And I can easily just intercede. So there's not this like weak lapse in treatment.
Yeah, that's awesome. And especially like when you're in the thick of it and it's your body, sometimes you can't see things objectively. So having that person that you can communicate with that can say, oh, have you tried this? It's like, what a great support system to have, especially when you're in something that's so meaningful to you. So I love that. And like, as far as managing hip pain, how do you help runners do that so that they can keep running, even if they have an injury and they're going through rehab?
Yeah. So I have 3 main steps that I work with my athletes through. So it's discover, develop, and deploy. And it's kind of a linear stage, but it's also, you can be exploring all 3 stages like throughout the history or the incidents of your injury. I would say the first thing with this discover is we like see, is this something that you should be running through, or is this something that you actively need to rest with? And during that phase, I really enjoy giving clients stuff that they can do. So maybe if it's a bone stress injury and they can strength train, I like to give them that. or just give them general things that will alleviate their pain. And then in the develop phase, this is where we start to add in some of the running. For some people, they're able to run, or for most people, I should say, they're able to run, but maybe we need to tailor their dosage, volume, like what kind of terrain they're running on. And if we really like nitpick those details down, I can get most people running throughout the course of their rehab. And then in the last phase, which is deploy, they're just really able to do whatever they want. They can, they're deployed to do a race or do training and whatnot. And they have all of those tools from the previous two phases to help them overcome their injury, manage pain, and go forth.
Yeah. Yeah. I love that. And especially since that, it's like, when it's what your passion is, you don't want to have a time where you're like, nope, you just have to sit there and let things run their course, like being active in that. And I love that. And you talk about this proactive approach. Can you talk about how you're proactive in it and even like preventing injury before people get to that point?
Yeah, I am really huge on prevention. I think there's so many things that you can do as a runner to not get into the overtraining and avoid injury. A big thing is strength training. So I offer a lot of different strength training options, but I also have like all of my clients when they're working with me have like a really, it's not a huge program, but it's a program that they're strength training consistently with. And then that allows them to kind of prevent injury. Another thing that I like to talk to people about is just overall running volume. So I work with people on not like increasing too fast. And that's even like on just like a personal level. I do like a ton of run groups in the area, and there's people that are like going marathon after marathon after marathon. And I'm like, okay, like what's your goal with this? Are you allowing yourself to recover and go forth and run like a better marathon the next time?
Yeah. Yeah. I like how you talk about that too. It's like, what's your end goal of this and not just doing more? And like, can you do too much? Can you talk on that? Like, is more always better when you're talking about running and training?
Yeah. So I always like to say, I'm kind of like a run coach with your tissues in mind. So when I say tissues, I mean like your joint cartilage, your tendon health, whatever it is. Like if you have a history of osteoarthritis, I'm going to say like, yeah, like more can be not great. Like too much can be too much for you. So I really like to take the person in mind and kind of see like, what is your tissue tolerance? And then adjust your training cycle to there. I would say for running, it is, I think it's easy to do too much because it's a very accessible sport. So you can just go and you could do it every day. You could just run a ton of miles every day. But the best way that I think to monitor that just personally is like read your body. If you finish the run and you're feeling achy and sore, then maybe that like the next day you take a rest day and then get back out and kind of just adjust and see what your tolerance is.
Yeah, I think that's such an important message, just being in tune with yourself, because I think sometimes, with a lot of sports and especially with athletes, we have a tendency to compare ourselves to other people, and everyone's bodies are different. Like you said, everyone's tissues are different. So if we're not in tune with ourselves, we're maybe trying to keep ourselves to an unobtainable standard. And
Yeah.
then that's probably when more injuries occur.
Yeah.
And when you talk about like rehabbing, are there some like myths that you see, things that people think about the hip, especially and rehabbing, that maybe aren't true and misguide people?
Yeah, for sure. I would say like the most blanket kind of just statement that I see with runners is all the time. I'll hear runners, they'll be like, they learn that I'm a physical therapist and they'll say, oh yeah, I went to a physical therapist one time and they just told me to stop running. Like not forever, but they just told me to stop. And they're like, yeah, I didn't go back, or I went back twice. And I'm like, that is maybe the case for some people. Again, like bone stress injuries, if it's like a really severe injury, I'm like, yeah, you shouldn't be running. But there's a lot of cases that it's like, I just don't feel like there was a deep enough dive into understanding what was going on with them, and then giving them some freedom for running. I would say another myth with just hips in general, or hips specifically, there's like just so much chat around like labral tears and FAI and like women and men that have them, like absolutely needing to get surgery. It's such a unique process for each person. The surgical like outcomes are variable. So I really, really enjoy educating women on basically their options and how it can play out for them, and then allowing them to make the best decision for themselves.
Yeah, that's great. And you talk about FAI. Do you mind just talking about what that is for people who may not know what that is?
Yes. So FAI is femoral acetabular impingement, and it's basically where either the like, because your hip joint is a ball and socket joint, so it's either where the socket is too small or the head of the femur, which is the ball, is too big, so they don't like just go really congruently perfectly. It actually is common that people just have these structural I don't want to say abnormalities, but things in their body. It's super common, but some people have just been diagnosed with them, and it is a source of pain for them.
Yeah. Thanks for talking about that, because again, people may be experiencing these symptoms and be like, is that what I'm experiencing? And then again, just having that knowledge of like what's going in my body and what could happen and what could be causing this is just really important for decreasing some of that fear. And that kind of is what I want to get into next. Like when someone has an injury, usually, especially when it's something that's so meaningful, like running to them, there's a lot of fear around that. What's your experience with working with people who are fearful, and how do they overcome that so that they can truly believe they can heal from a hip injury or any kind of injury with running?
Yeah, for sure. So I would say the best advice that I could ever give someone is just find someone, like if you have a hip thing going on, if you have a shoulder thing going on, whatever it is, find someone that specializes in the thing that you're going through and talk to them about it. Like I always say, just find your team of people. Even I myself went through a hip injury, I think like 2020 is when it started, and I spiraled. Like I just like immediately contacted an orthopedic surgeon and was like talking to them. And I'm like a known, like, this is like my thing. Like I love to do this. So finding people that you can bring into your world and kind of like talk you off the ledge, talk you back into a like a better just space of mind, and can give you like real objective data on what's going on, so you're not living in the stories in your head. I think that's the best thing you could do.
Yeah. And like you said, the stories in your head, you can catastrophize very quickly and think the worst case scenario. And then it actually moves you in that direction. So having somebody who can like pull you back and really give you that information, again, see it objectively, is so important with the rehab process. And one thing that has always resonated with me is that you're best suited to serve the people who you used to be. So like for you, you know, you've gone through it, you know exactly how that person feels, you know what they're going through. You can relate to somebody in that position better than someone who hasn't gone through that. So again, I love that recommendation, is like find somebody who's been through it and knows what they're doing. And I really, truly believe in that. And you have to find someone who resonates with you. And that's part of the healing process. So right there behind you on that one. As far as keeping running enjoyable, because again, sometimes, you know, you feel like you're doing more and more and there's a competitive edge, and it's like, you know, I could see it, you know I was like this when I was really into running. It's like, you always feel like you're not, it's never enough. Like you feel like you have to do more and more, like to kind of get that same result. How do you recommend your athletes and your runners, how do you recommend keeping running enjoyable when there's a lot of pressure sometimes around running?
Yeah, for sure. So I would say around like kind of, I think the biggest area that it becomes anxiety provoking is the races. So again, I'm in these run groups and there's so much pressure to like join this race and join this race. And I just say, look out, like zoom out at the year, pick out a couple races that sound really exciting to you. Like maybe you get to travel with your family for a race, or maybe there's a local race that you love to do, and then plan one for each season, or just like really intentionally plan them so you're excited about them throughout the year. You can plan in like deload or kind of rest times where you're able to like ramp down and then ramp back up. Just so those stay exciting. And then I would say joining like a local run group is an awesome way to just stay connected in your community, and then also get you to do stuff that you wouldn't necessarily want to do. So if I need to run hills or sprints or speed work, I'm definitely doing that with my run group, because I am not going to do that on my own.
Yeah. Yeah. You can never underestimate the power of a group and a support group and having people that understand what you're going through and how you're feeling. So yeah, that's amazing. And again, kind of going into that, like, how do you, it's kind of in addition, like, how do you maintain a healthy mindset around running? Like, I know you said to do all those. Is there anything else you can do if you're more of like a solo runner where you want to just maintain a healthy relationship with running?
Hmm. Yeah. So I talked about this with the race schedule. I really enjoy having that race kind of be your like your goal, and then putting in some rest time where you're really not running as much, or you're running like considerably less, or even like cross training or doing something like that.
Mhm.
I would say if you're a solo runner and you're not a racer, I would have some intentional time where you're deloading. So maybe if you go on vacation like 2 to 3 times a year, those are times that you're going to take time off of running. If it's not vacation block, like something that's just going to kind of put a roadblock into your run, maybe 2 to 3 times a year. It really depends on how much you're running and what your volume is, but just some time where you're allowing like your tissues to rest, your system to rest, and you're not just constantly ramping up.
Yeah, yeah, that's great. And it's so good for putting in perspective that you can almost give yourself permission to not feel like you always have to be running, that there are other options to keep moving forward, even though, you are dealing with certain things at that moment. So definitely really good tips there. And I know you talked about you had had a past injury. Are there any other like injuries you had, and like how did you overcome that when it was so meaningful for you? Are there any other things that you went through that kind of gave you a different perspective?
Yeah, I would say I've had like two injuries that I would say kind of really hindered me from what I wanted to do. When I was in grad school, I had an Achilles tendinopathy. And that was the first time that I was not able to run during that time. It was like painful and uncomfortable. And I think that was the first time that I really like had to ask for help.
Mhm.
And it was hard. Like it was really hard to one, schedule the time to go to physical therapy. And then two, like admit that I didn't know what to do and I like needed someone to help me. And I was like barely a first year grad student. So we didn't even go over orthopedic stuff yet. I didn't know what to do.
Mhm.
So that was a unique experience for me. But I would say having someone like hold my hand through the process taught me like the value of that. And
Mhm.
then watching myself on the other side not have to go through like all of these flare-ups,
Mhm.
that was amazing, just to be like healed of it and know what to do.
Yeah, that's amazing. Yeah, and especially having that guide, because sometimes when it's our own body, like we get in our own head and we don't see things for how they really are, and we are our hardest critic. So it is so
Yes.
important just have somebody like hold your hand through it, and like keep you going in the lulls, but celebrate the successes when you're doing that. So yeah,
Yes.
100% with that. Can you mind talking about like your self-care routine? Because this is such an important thing, like for everybody. And I really think and it can look like a lot of different things. It's not just like a day at the spa. It can really have a huge gamut of what self-care means. So could you just talk about what you do personally?
Yeah, for sure. So my schedule is a little bit like newer to me now, because I have like changed my work sphere. So
Mhm.
I am experimenting with it, but I start in the morning. I do my quiet time. I'm a Christian, so I love to read the Bible and pray and just journal and do all of those good things. And then about like midway throughout the day, I either like to take like a walk break where it's just like I'm decompressing from what I did in the morning time. And then sometime in the afternoon, I enjoy going to the gym, and just having that intentional time to get stronger and again decompress. And then I think outside of like work and working out and doing my quiet time, I think like scheduling good time, like good intentional times with my friends and family, are the things that that's what keeps me excited. It makes me have something to look forward to. And also like when things aren't going well, or yeah, I'm like struggling with anything, that's just like a good checkpoint for me to be in community and like be checked in upon with those people.
Yeah, yeah. Thanks for sharing that. Because again, I think it's always just important to hear what other people do, because you have to figure out what resonates with you. Like, and it's like, it'll change depending on who you are, and it'll change depending on what season you are. But I just love hearing different examples of self-care because it does take on a lot of faces. So thanks for sharing what you do. And
Yeah.
for anyone who wanted to work with you or learn more about what you do and the services you provide, how can they find you?
Yeah, so I would say the easiest way is my Instagram. I am Dr. Sarah _ the hip doc. I'm on Facebook as Sarah Louie, and I have a couple of Facebook groups, Women Runners with Hip Pain, and Seattle Women Runners. I think those are the easiest ways. And then from there, I can connect to email and whatnot.
Awesome. Thanks for sharing that. And I'll make sure I put it in the show notes for anyone listening so you can connect with Dr. Sarah Louie. And thank you so much for giving such insight today, because it's, again, there's so many people who deal with hip injuries or just have weakness or need strengthening or need just some kind of outlet to figure out what to do. So thank you for sharing all your knowledge in that realm.
Yes, of course. I could talk about hips all day long. So thanks for letting me.
I love that. It means you're in the right place.
Yes.
Well, thank you. And thank you again. And for everyone listening, please again, subscribe to the podcast and leave any questions or comments, and we'll be sure to get back to you. So thank you again. Thank you for spending your precious time to listen to this episode of Rewiring Health. My mission is to inspire hope and healing through science-backed practices. If you found value in this, please share with 3 people and leave a review. By doing so, this message can be spread to those who need to hear it most. Also, to get updates on the most recent episodes, please subscribe to the channel. Thank you so much for being part of this community, and I am forever grateful for you.